What is obsessive compulsive disorder, OCD? Obsessive compulsive disorder, OCD, is a mental health condition characterized by the presence of obsessions and compulsions that cause significant distress and impairment in a person's daily life. Let's break down the key aspects of OCD, including its causes, symptoms, and treatment, as well as the criteria outlined in the DSM-5, the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. Causes: genetics. There appears to be a genetic component to OCD as it tends to run in families. Brain chemistry. Dysregulation in the neurotransmitter serotonin may play a role in OCD. Some parts of the brain, like the orbitofrontal cortex and the caudate nucleus, are also implicated in the disorder. Environmental factors, trauma, infections, or stressful life events can trigger or exacerbate OCD in susceptible individuals. Symptoms: OCD is characterized by the presence of two main types of symptoms. Obsessions. These are persistent, intrusive, and unwanted thoughts, images, or urges that cause distress. Common obsessions include fear of contamination, doubts about safety, a need for symmetry or exactness, and intrusive sexual or aggressive thoughts. Compulsions. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession or according to rigid rules. Common compulsions include excessive hand-washing, checking, counting, or repeating actions. DSM-5 criteria: A. Presence of obsessions, compulsions, or both. B. The obsessions and compulsions are time-consuming, taking up more than 1 hour per day, or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. C. The obsessions and compulsions are not better explained by the symptoms of another mental disorder. D. E. The symptoms are not attributable to the physiological effects of a substance or another medical condition. Treatment: cognitive behavioral therapy, CBT exposure, and response prevention. ERP is a specific type of CBT that is highly effective for treating OCD. It involves exposing individuals to their obsessive fears, exposure, and then preventing the associated compulsive behaviors, response prevention. Medications, selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, sertraline, and paroxetine, are often prescribed to help manage the symptoms of OCD. Combination therapy. In some cases, a combination of CBT and medication may be the most effective treatment approach.